Now I want to bring in Dr. Yakubu Mohamed Sani. He's the Democratic Republic of Congo's country director for ActionAid, an international charity organization, and he's with us now live from Kinshasa. Thank you very much for joining us here on Al Jazeera to talk about this. One of the questions that I think many people have been pointing to during this is obviously DRC, and this area of DRC in particular have been gripped by unrest and armed conflict in recent years. Many health centers in this area have been destroyed. How difficult does that make the situation on the ground right now?
Yes, actually, the outbreak is having telling effect on the persons of concern, where they are actually coming up from situation of where we have multiple and recurring displacement accompanied with loss of livelihood, accompanied with sexual and gender-based violence, and other protection risks which are associated with our country, especially the persons of concern. So now this situation has actually aggravated the entire situation in that the health centers are actually trying to respond to the situation, but we're actually calling for a coordinated response because this is not actually a health issue. This is actually a developmental issue, and it needs to involve the people who are actually affected, especially the community members and families who are affected by Ebola, to be part of this response. And another area we're actually calling for is to ensure that we have very clear communication channel to address issues around miscommunication and ensure that even at the community level, we have channels of communication whereby people can actually respond based on reliable information.
And what are the challenges of doing that, of getting that information out, of making sure that people understand in helping to get an outbreak like this under control, especially when it comes to finding and tracing contacts of people who may have been exposed?
Yes, we have a number of community agents whose capacities were built in the earlier response, and we are now leveraging on-site people to provide that kind of leadership and also ensure that community members, because these are community members and they know one another, and at least the health facilities and the health professionals are actually working closely with the communities to ensure that at least contact tracing becomes a bit more easier. And we are talking about the outbreak in some 3 key areas, that is Bunia, Irumu, and the Bunia, Irumu territories. And these territories, at least we have the necessary responsive mechanisms to ensure that people get the necessary information to be able to respond. And also logistics have been provided to an extent that even we have test kits now in Bunia, where we don't have to refer cases to Kinshasa, but at least there are test kits in Bunia to be able to ensure that at least people are tested and their results are verified to ensure that we have a more coordinated response.
How big of an undertaking is that to make sure that you can do these localized testings, given the logistics of the area? And are the health centers there prepared to sort of spring into action, or do you need to wait for some of this aid to come in from the WHO?
No, we are actually going ahead. We are going ahead, like I did mention to you, that this is not new to us. At least we have the capacity to be able to respond. And for us as ActionAid, we are working closely with our community protection monitors whose capacities were built in such an area. And currently, we're also providing a lot of capacity building to make sure that we are able to respond. But one other area we need to emphasize on has to do with the mental and psychosocial support. Don't forget that these are people who are already traumatized. They have actually gone through a lot of issues around displacement. And it is important that we continue to provide this kind of psychological support to them. Education continuity is also very critical. And for us as ActionAid, we are working around, one of our initiatives is around the prevention and control of infection. So we are now building on it, looking at the new cases which are coming up and what kind of new information it is that we have to provide to the communities, to the school clubs, as well as the teachers and parent committee, to make sure that at least they take leadership in providing this information to address issues of misinformation. So we are currently responding to the situation.
The WHO is also urging countries not to close their borders at this point or to restrict travel. Do you think that's realistic, or do you think that might be something that comes later down the road?
No, I think that is quite realistic because even if you look at the area that we are talking about, Ituri, it isn't the whole of Ituri which is where we have the outbreak. It's just about 3 territories within Ituri which has the outbreak, and we are trying to contain it within these 3 territories. So there's no actual cause for alarm to call for the closure of borders.
Okay, so the outbreak, as you're saying, is not quite there yet. But I wonder how, as we look towards trying to trace all of these contacts, people that may have been exposed, some people are concerned, or there's been some concern from health authorities that this outbreak may have been going for possibly weeks before it was identified. How difficult does that make it when you are trying to do this contact tracing, even if you are as best prepared as you can be? How difficult does that make things for your teams?
Yeah, it's a bit difficult, but the good thing is that, like I said, as an organization, ActionAid is actually a rooted organization, and we work very closely with the communities. So at least we're able to support to get information around the movement of people, which also help in the tracing of contact. At least within the communities, people are very much aware of those who have recently come into the community and those who have actually moved out. So it makes things a bit easier. Though it's quite difficult in terms of accessing to insecurity and what have you. But we are doing our best to ensure that we're able to contain this situation and also ensure that education is not suspended, because it just left with 1 month for children to actually close from school. And you know that they have actually missed a lot of lessons which were actually supported through catch-up lessons and other non-formal education initiatives. So we are asking that at the community level, we are working closely with the school authorities to make sure that we are able to develop a school continuity plan to ensure that at least education delivery does not stop. And also around protection, we are working closely with the women's group as well as the men's group to make sure that the right information is actually received and disseminated in the community, and also collaborate with all the key stakeholders to ensure that at least they are able to provide the needed information to facilitate contact tracing.
Dr. Yakubu Mohammed Sani, Country Director for ActionAid for Democratic Republic of Congo, thank you for taking the time to be with us today here on Al Jazeera.